Welcome everybody to today's webinar. My name is Hannah Delmet. I'm the Director of Partnership Development with Concordia, and I'm so pleased to have everybody on the line for today's World Health Day webinar. It's wonderful to have so many businesses and civil society leaders joining today's call, and I would like to thank Matthias and the team at Bayer for partnering with Concordia for this webinar. Before we get started and I turn to Matthias, I want to take a moment to ground this discussion in Concordia's mission of strengthening and supporting the partnering ecosystem. Now is a critical time for cross-sector collaboration, public-private partnerships, and a unified world. And that's why Concordia is reaffirming its unwavering commitment to maintaining its position as a leading nonpartisan convener alongside the UN General Assembly. And while the unprecedented nature of the virus is calling for a temporary increase in physical distance, it doesn't mean we can't still come together. This virtual discussion on the role of partnerships on the front lines of the global response to the pandemic is designed for the Concordia member community, especially those building partnership-based interventions to support local, national, and global health responses. Concordia's Department of Partnership Development is ready to support the formation and structure of new local and global initiatives, contributing to the response through impactful and transformational partnerships. I encourage you to connect directly with me or any member on my team during or after this call if you think Concordia can play a role in the design, the structure, the framing, or the support of your partnership. We're also still planning to host the largest and most inclusive event alongside the UN General Assembly in New York this September. The dates are September 20th to the 22nd. I hope we have the opportunity to welcome everybody on this call to that, which will be Concordia's 10th anniversary and our 10th annual summit. We're designing influential and substantial programming dedicated to global health, and I encourage you to connect with our Director of Programming, Kevin Wenzel, who's also on this call, if you're wanting to be a part of that programming process. Finally, Concordia is a membership-based organization. If you were invited to this program by Concordia or Bayer due to the relevancy of your work on this topic, welcome. Great to have you. I encourage you to consider Concordia membership and be a part of this global partnership-based transformation. Community lies at the heart of all we do. As we navigate this complex and tumultuous time together, we're focusing on how we can partner together for a better world. While it feels at times like life has been put on hold, at Concordia, we're doing absolutely everything in our power to strengthen our community and double down on our values of collaboration, partnership, and unity. So in shifting to today, I just again want to reiterate that today is World Health Day. As of today, there are over 1.3 million COVID-19 cases globally, and we know that number is likely much lower than the actual account due to challenges in the testing and reporting spaces. And so that's some of the things that we'll unpack a bit with Matthias from Bayer. Before we get into that, I want to direct the joiners who are using the web platform to the chat side of the call, and for our audio listeners, I'll go over some of the details, just some of the housekeeping bits. So all attendees are automatically muted upon entry. You've probably noticed that. If you want to ask a question, if you're using your web portal, you can raise your hand on the chat feature or use the Q&A box. And we'll make sure to call on you and unmute you during the conversation space, because we do want to be hearing from our members in the audience around what they're working on. So use that Q&A feature to ask questions or to upvote those questions that are submitted by your colleagues. We'll be answering those at the end of the session, and you can also raise your hand during that Q&A piece. My team members will be monitoring that chat feature, but the Q&A block is definitely the best way to go. We'll be having some polls throughout the conversation, so please do answer as those pop up, and that helps us not only design our work, but it will help Bayer in their work as well. And finally, this webinar is being recorded. It will be accessible via the Concordia website for future viewing and sharing. The Q&A piece will actually not be recorded. That is a special perk for our members who are joining live today, but overall, the video will be recorded. So with that, housekeeping check. We are going to introduce Matthias. Matthias Berninger is the Senior Vice President for Public Affairs and Sustainability at Bayer. And following over a decade of working with the Mars Health and Nutrition Strategy team, he joined Bayer last year. Prior to his work in the private sector, he had a career as a German politician with the Green Party, where he also served as Parliamentary State Secretary at the Federal Ministry of Food, Agriculture, and Consumer Protection. Matthias recently moved with his family to the DC area, and we're happy to welcome him to today's webinar and America. We're fortunate to have someone join us who understands both private sector and public sector processes and strengths, as currently addressing coronavirus will require knowledge of both. With that, I'll turn to Matthias for a few words about some of Bayer's work that he's proudest of, and then we'll dive into a back and forth around the role of partnerships. Matthias?
Yeah, so thank you for introducing me and also giving Bayer the opportunity to share a bit our experience in dealing with the corona crisis. Well, way before this was a pandemic, we got involved when the first cases in China popped up. And that was also for us the starting point to learn how to collaborate with hospitals, with state and non-state actors in China. For us, it was really a great opportunity to start to collaborate globally from the start. Today is World Health Day. And I think one of the core messages that should come out of this pandemic, the only way we will deal with such a health crisis as the one we are facing right now, and the many other health crises the world is dealing with, is through global collaboration and through bringing people together. Bayer is one of those companies that is present in almost every country in the world. And for me to see my colleagues, of course, a lot now via the screen, coming together, working together on addressing the challenges we face in the moment, gives me energy every day, and is something that people need to bear in mind when they're criticizing multilateralism, globalization, and all those other terms. I think it works really, really well right now, and we have made great progress in collaborating across many countries. What are the main things we have seen? I think the first thing we have seen since the beginning of the crisis is that many of my colleagues basically raised their hand and came up with the ideas. And it's really important to give those ideas room to grow and not to stifle them early on in the process. Those ideas led to us overnight shipping drugs for clinical trials into China. It led to local teams deciding pretty large donations for hospitals and other organizations that needed it. It led to a transformation of a crop protection plant into a plant that now makes all kinds of disinfectants. It led to the R&D team of Bayer realizing that we have a huge asset sitting in our laboratories, large-scale PCR machines that really were able to accelerate Germany's testing capacity. We will, by next week, have 200 people, Bayer colleagues, volunteering and doing tests in Germany. It also led to intense dialogue with governments around the world in further improving the treatment strategies to help patients. And if I look at all of those things, for me, probably the most important insight is that we, as a company, didn't even know how much potential contribution we could make to help solving this crisis. So it unlocked an amazing number of projects around the world. On the other hand, let's not forget that ensuring business continuity was crucially important for Bayer. In normal times, we make life-saving medicines, and to ensure that we can continue to produce them, even in factories that are at the epicenter of this crisis, like in Lombardia in Italy, was an effort that took a lot of people to really kind of, yeah, sometimes even sacrifice the safety of their home and take the risk to go to those factories. Of course, we're ensuring safety, but for people to come to work every day, for those that couldn't work from home and don't have the luxury to basically work through tiny little screens, is really great to see. The other example, Bayer is, half of it is a healthcare company, half of it is a food company, is how the teams ensured that farmers around the world have the necessary inputs to start their growing season, and also that our own teams are able to produce the seeds for the 2021 and 2022 harvest. we take those things for granted, but what we had to learn in the last 4 to 8 weeks is you can't take it for granted. It takes a lot of creativity. It takes people coming up with new ideas to really make that happen. It also takes a lot of learning from others. So while we are sharing a lot of things here, I give you an example of what inspired us. There were small firms with 3D printers who printed protective masks for healthcare workers. And we realized, hey, we have quite a few of them, for example, in St. Louis, and we were able to mobilize them to make, and our plan is up to 5,000 masks, which are desperately needed in Missouri and the rest of the region. So we've also learned from others, and that's really important. Small and big initiatives are a rich, inspiring reservoir, and we have tapped into it quite a bit.
Great. Thank you so much for painting with that broad brush the range of ways that Bayer is reorganizing and leveraging its value chain and its one of its most important assets, its employees, to think through the healthcare side, while also not forgetting the importance of long-term focus on things like food production and food security. I'd like to turn to some of the specifics around how you've been working with other companies, with other governments, with other research institutes around this, just to give some advice for those joining today who are part of their own partnership and designing something or thinking of partnering to work in their own communities. I know that Bayer has been working a lot, obviously, with the German government, with that being where you're based, international governments as well. And I'd like to stay for a moment on how those relationships work, where they started from, how you've actually gone through the minutia of arranging what can be done to make sure that donations or other support that you're ratcheting up is distributed in the best way possible. Who do you go to for that? Who's your point of contact within a government, and what does that back and forth look like?
Yeah, I can start with China again. Our stakeholders in China, government stakeholders, and also people who are more in the research and development space, are super accessible, especially at the moment. So WeChat is the key tool to get in touch with them. I've never seen them more responsive and more willing to help. And that for me is, on a micro level, a really encouraging sign. Generally speaking, when you work with governments and with regulators on normal days, you need to go there. So you lose a lot of time in just physically meet people and coordinate all of those meetings. Currently, things happen much quicker. And I think that's really important. What helped me is I was part of a government in dealing with a crisis. It was mad cow disease in Europe. Of course, you can't compare that crisis to what we are facing at the moment, but it taught me a lot of respect for what it means to be in a government position to solve this problem. We realized they need a lot of support and help, but they also need us to really focus on what's most pertinent. And a lot of people want to help, but when you engage with government, make sure that you really don't overburden them with things that they currently can't handle, because the pressure on most of the crisis teams in small and big countries is enormous. The last thing I want to say in terms of what helps is, if you are not trying to seek any advantage for your business. For example, there are a couple of medications that are having been used experimentally in the treatment. Of course, none of those medications are approved, but our decision to basically donate those medications to governments has helped the conversation and sped up decisions to include them in clinical trials and to really unlock some of the challenges you would normally have when you talk about a highly regulated area like of course the area of pharmaceuticals. Lastly, the Bill and Melinda Gates Foundation deserves more credit than I can express today for how they have brought together the industry way before this crisis started. And that was tremendously helpful in also bundling the industry activities and streamlining them. So the calls they have started early on, the meetings they have facilitated were, I believe, a major also ingredient in our success in trying to help stabilize healthcare systems around the world.
Last week, we spoke with MasterCard, who's a part of a different partnership with the Bill and Gates Melinda Foundation. And one thing that they said that sounds like a piece of advice or a success that you've just expressed was partnering with a group that's able to galvanize a wide industry approach and serve as kind of a central node so that there's more efficiencies, more collective action. And at the end of the day, you don't have 30 disparate groups going to the same input or stakeholder within a government and taking up that time, but it's rather a quite focused approach. And so I'm glad you brought that up. Within Bayer, I think one of my favorite things in doing research for today's conversation is just, again, that entrepreneurial spirit that's been fostering throughout the Bayer workforce around the world as people think through the different touch points they have with the 3D printers, with the different value chain aspects and how that's transforming what business as usual looks like for you. Can you speak a little bit about the corporate attitude and how you actually put in place the space for this collaborative and innovative thinking while also ensuring business continuity? How does an organization decide to invest in a partnership, but at the same time make sure that it doesn't take away from the day-to-day necessities?
I want to start by saying Bayer is one of those companies with a huge R&D budget. So we are in the top 50, we are middle of the pack, I think 23 in global R&D investment every year. With that, of course, comes that we have a lot of scientists as part of being Team Bayer. Yeah? So we have lots of people that work in our R&D department, and they happen to work on topics of health and nutrition, which is obviously not a surprise. And I noticed that, first of all, this crisis underlines how important scientists and scientific excellence are, but to unleash their creativity was one of the key things we have been starting from day one on. And that led to the example of mobilizing our PCR testing capacity in Germany. Germany is already doing quite well with the number of tests, and that is one of the reasons people believe Germany is currently dealing relatively better with this crisis. But also Germany experienced a huge bottleneck in terms of speed of getting the test results done and back to the doctors and the patients. And we were able to remove parts of that bottleneck through very creative moves. We needed approval from the authorities. We got that literally over a weekend. We needed to mobilize volunteers. That wasn't a problem for us. Even we have now mobilized doctors and nurses who are Bayer colleagues who will actually volunteer in hospitals and other places. So for me, what I want to say is this mobilization is crucial. And I don't believe this crisis will be over anytime soon. So this is a recipe that can be used throughout managing the restart of our economies. I don't believe we will just go back to square one. So trusting the creativity of your people on the ground is crucially important.
How did, great, and thank you. We do have a poll that's just open now with regards to the different ways that Bayer is or could be responding at a global level. So we encourage people who are joining and who can see the poll to chime in there. Let's speak a little bit about that bottleneck for just a moment. Was Bayer approached to help address that bottleneck, or did this motivation come from within the company? How did you decide that it was up to you and your technical expertise to be the one to solve that in Germany?
Yeah, no, it was an inside-out thing. So the idea came from local R&D teams who work with those machines every day in Wuppertal and in Berlin. Basically, those are two research centers of Bayer in Germany. And they realized, oh, we have something here, and we realized there's a bottleneck. And then we called both companies that provide testing as well as government authorities to make this happen. We also realized that we have a lot of mobile PCR machines that we basically put in motion and donated to hospitals. We were lending them all kinds of ventilators and other equipment we had. And the idea really was, how can we help? We have this vision of health for all and hunger for none. And that, of course, helps because it gives people in Bayer permission to think beyond their day-to-day concerns. And I have to say, the folks in R&D, they're not sitting there turning their thumbs, because in parallel, they had to figure out how to continue clinical trials, how to make sure that we are not dropping the ball on some of those studies that are out there sometimes for many years, in order to find new drugs and solutions for health problems we haven't solved. So people did that on top of their day-to-day job.
That's commendable. We're going to turn to audience questions in just a moment, and I'm pleased to see that we have one submitted from Carolyn Miles from Save the Children. Before we do so, and I encourage others to take advantage of that Q&A feature, before we do so, one last question about civil society. We do have, again, some great groups who are on the front lines of deploying or supporting frontline healthcare workers on this call. How are you partnering with them? How are you partnering with the actual hospitals or the intermediary nonprofit and civil society groups in terms of donation allocation, identifying who needs what, how to get it there?
We early on earmarked a pretty large amount of money and shared with our colleagues on local level that there is money there from the Bayer Foundation, that there are product donations out there, donations of equipment, in order to remove this barrier where people think, well, how do I get this done? Yeah. And with that, we believe we went the right way of mainly partnering with country and local initiatives, rather than trying to look for one global partner and have a conversation with them. Now, I believe in and not in or, so we are also open, of course, for broad global partnerships. But the idea was to mobilize the creativity and to meet the needs in the different countries. What we realized is that even though the virus is the same, the needs in different countries to battle this virus are quite different.
That's great. And I'll say in terms of corporate communications, you have this great resource. I'm going to leave it in this chat feature for others to visit, but a nearly daily update of what you're doing, which I think is really illustrative, and it gets people thinking and it breaks down that barrier. And I imagine that more people have come to you with requests or ideas or thoughts because you've been so externally facing about some of the work you're already doing. So just want to make sure people know that that's there, and that it looks like there's a pretty open channel of communication with the foundation and the company on how to work towards this. So if that's a space for Concordia to support through our Concordia Connect services, please let us know. Great, I'm so excited